it was this kind of instant realization that like my numbers, my science, like every single number wasn't a number, it was a kid. Like, and it represented a child, and a child that I've probably even seen in the last year. And I knew those kids, I examined those kids, I've given those kids high fives and fist bumps. And it was those kids that like jumped out of my spreadsheets and lifted me up and gave me the courage to keep going.
Corporate fraud works best in the shadows, behind corporate walls. How does the government bring these wrongdoers to justice? Whistleblowers. These are the stories of those who risk their careers to shine a light on allegations of fraud. Today on Fraud in America.
Today's episode of Fraud in America, we travel to Michigan to speak with Dr. Mona HannaAttisha, the public health advocate whose research exposed the Flint Water Crisis. Affectionately known as Dr. Mona, she was named as one of Time magazine's 100 most influential people in 2016 for her work in exposing this public health crisis of elevated lead levels in the Flint, Michigan drinking water. Dr. Mona is the director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative. She is a pediatrician and the associate professor of pediatrics and human development at the Michigan State University College of Human Medicine. She chronicled her fight for the people of Flint in her best-selling book, What the Eyes Don't See, a story of crisis, resistance, and hope in an American city.
So Dr. Mona, is it okay if I call you Dr. Mona?
Is
that what, that's what everyone calls you?
Mona or Dr. Mona is fine.
Awesome. Perfect. Love it. So yeah, my wife's an OBGYN. So when I told her I was going to talk to you, she was very excited to hear this interview. You've impacted a lot of people, so I appreciate you taking the time with us today. So I ask a lot of people this, it's interesting. We work with whistleblowers and inspire and encourage people to come forward and highlight problems that are happening. That point where people make that decision to step forward and sound the alarm is always so interesting to me. When was that for you? Why did you decide to step outside the safe confines of being a pediatrician, a researcher, and then all of a sudden you're having a press conference sounding an alarm? What made you make that decision?
Deb, that's a great question. And, I don't even think there was a decision. It was, I've said it before, it was like a choiceless choice. Like it was what I had to do. When you hear of something as devastating as lead exposure, when you've taken an oath to be a pediatrician, but, it's not just about being a pediatrician, it's about doing the right thing. And there wasn't an option for me to stay silent, to ignore this, to not do anything. The path was only to go forward. And I think maybe there wasn't an option because I didn't even consider myself to be a whistleblower. Not until I talked to my brother, by serendipity, the weekend before I was going, sharing this research, he had come home for his law school reunion. And he's like, how's work? And I told him like, oh, I'm doing this research and there's this water problem and kids are being exposed and we're going to probably have a press conference to share this. And he pulls me aside. He's like, Mona, you realize you're a whistleblower. I'm like, I'm not a whistleblower. Like, this is my job. This is what it means to be a pediatrician, is to be an advocate. So I didn't even think of myself as a whistleblower until he told me I was a whistleblower.
Oh, wow. Use that word serendipity. There, in reading your book, by the way, if anybody's looking for a great book, highly recommend Mona's book, What the Eyes Don't See. It's a shorter part of a longer quote from D.H. Lawrence. The mind doesn't know what the eyes don't see, right? This whole idea of whistleblower and stepping forward and shining a light on fraud, to me, is very interesting because there were a lot of other people who had tried to sound the alarm, right? Can you talk about Leanne Walters, for example?
Yeah. I could talk about her forever. So Leanne Walters is this amazing Flint mom raising her kids who noticed that her kids were getting sick, all these different issues. And she asked questions and and she was trying to figure out the answers. And she pressed every single button at the local level, at the state level, and even contacted, the EPA. And throughout this whole time, she was being dismissed. She was being denied. She was being discredited. So she looked at the list of ingredients on the water department's website, and she noticed that there wasn't something called corrosion control. And she's the one that notified the EPA that Flint wasn't treating their water properly. A mom who's this is not her line of work. And she figured all of this out. And I think this echoes to so many other incredible stories to our time where moms have stepped up, especially with environmental disasters, and not only have fought for their children, but really fought for the entire community's children. So, Leanne Walters, we would be nowhere without Leanne Walters and many other Flint activists who were sounding the alarm for about 1.5 years before I got involved. They were loud, they were organized, they were going to town hall meetings with jugs of brown water and getting arrested. They were meeting with, bureaucrats but unfortunately, they weren't being heard.
And why do you think your voice changed all of that, or at least was a big reason why it all changed? Because you're right. In reading your memoir, there were lots of other people, Leanne Walters, Miguel Toro. There was someone at the EPA who had a memo that was leaked, and still nothing happened. Why do you think things finally started changing when you spoke up?
Yeah, there was a string of folks trying to raise the alarm bell. Moms and pastors and journalists, amazing journalists and scientists, water scientists, amazing team from Virginia Tech University that uncovered the Washington, D.C. lead and water crisis. Folks at the EPA, like Miguel de Toro, there was a 1.5 years of folks that were trying to put a spotlight on Flint, trying to say that there's something wrong, that were also telling us that there was lead in the water. But throughout, every single person who raised up their hand and said something is wrong, they were met with dismissals and denials and attacks from state government predominantly. And then I spoke up, and it took a while, but finally, that got things to change. And I don't know why, because it finally changed when I spoke up. I think it's because, here was this doctor with a long white coat and lots of degrees after her name who was, proving evidence of harm, that things finally began to change. It never should have been that way. We should have listened to the first mom that had a concern and the scientists and all these other folks. But when I speak to doctors and academics and scientists, I really emphasize this point, that when we get out of our cozy ivory towers in our classrooms and our hospitals and our labs, and we use our very credible voice, people listen. We were loud and stubborn and persistent, and it was finally kind of that voice that got the state and the media's attention.
In the book, you talk about how you were then attacked, and it's such a common story that we hear with our whistleblower clients. That people step forward, and oftentimes these employees who are highlighting a problem say, this should be our employee of the month. That person is alienated, they're terminated, they're ostracized. Yeah. Similar things happened to you, right? You were attacked by the governor, cited as causing possible or near hysteria, kind of a sexist term. Can you talk a little bit about the attacks that came your way after you stepped forward?
Yeah, having that conversation with my brother the week before going public, he was trying to prepare me for that. So he was giving me big brother advice, but also lawyerly advice. He's like, Mona, you might get retaliated against. People might start intimidating you. I have, clients who've lost their jobs and can never get hired again. And their family life gets ruined and they've gotten divorced. And he shared, he's like, I just had a client, who actually committed suicide because of that pressure of going public. After hearing all this, I was like, okay, I don't know what's going to happen, but there's also precedent, like everybody else in this Flint story has also gotten attacked. So I was trying to prepare myself for what could happen when I shared this research. So had this press conference, which is not something that obviously doctors and academics usually do. That's not how we share research. So literally walked out of my clinic with my white coat on and stood up at this press conference, sharing the science. And you know what? I felt awesome. I'm like, yay, like I am doing the right thing. Like I just have like science and facts. Like who can dispute science and facts? Like, can you imagine being in the middle of a public health crisis and not listening to science? So that's totally sarcastic. So, I felt awesome. Like this is my job. Like this is why I went into pediatrics to advocate for my kids. Not only, pediatrics is not just about like treating ear infections, but it's also about addressing those upstream inequalities and injustices and trying to, address some of these systemic inequities. I'm like, I feel awesome. Like finally people are going to know about this problem and they're going to get protected. And maybe we'll even switch our water source back and we'll protect kids. So I felt awesome for like 30 minutes. And then, like, as you said, the state and every arm of the state and even the federal government went after me, calling me things like an unfortunate researcher, that I was splicing and dicing numbers, that I was causing near hysteria, which, as you said, is sexist and has been thrown against so many women over time. And then they also said that their data, because my research was on blood levels, and blood levels are part of surveillance systems. So the state actually has a lot of this data, which I had tried to get in the beginning, but was unsuccessful. And they said, not only like, do not know what you're doing and that you're like this local pediatrician, that, speaking out of term, but also that their data, this larger data set that they had, was not consistent with my data. So I was flooded with attacks, and it's hard not to feel this big. Like I was scared. I had just gotten a Fitbit like right before all this. So I could see my heart rate like easily. Obviously I'm a doctor, so I could tell my heart rate, but like I could see my heart rate and it was like close to 200. Wow. Like I was shaking, I was physically sick. It's physically demoralizing. I began to second guess myself. I'm like, oh, maybe I am wrong. And I think a lot of kind of women go through this like imposter syndrome, like, oh, maybe I shouldn't have spoken up. Maybe this wasn't my expertise. Maybe this was somebody else's job. So there was, a period of really feeling threatened, belittled, and fortunately, quite quickly, I realized like, hey, this, they can go after me all they want. Like, fine, like hurl these attacks at me. That's whatever, this wasn't about me though. Like this was about my kids, my Flint kids. And it was almost as if, and I still recall this so clearly. It was as if my research, which is numbers and spreadsheets and Excel documents and statistics, it was as if like, it was this kind of instant realization that like my numbers, my science, like every single number wasn't a number, it was a kid. Like, and it represented a child that I've probably even seen in the last year. And I knew those kids, I examined those kids, I've given those kids high fives and fist bumps. And it was those kids that like jumped out of my spreadsheets and lifted me up and gave me the courage to keep going and to fight back. So, I credit kind of being able to kind of overcome this pressure of being a whistleblower by kind of being grounded in my why, which is my kids, and having that realization that, this is about something that's so much bigger than me. This is about them and not just them today, but really their potential.
I love that you refer to your pediatric patients as your kids. My kids, you say in the book, your daughter's 6,000 brothers and sisters that you spend time with. That's awesome. So let's go back a little bit. I really appreciate that you shared about your childhood and your family's decision to come to the United States. Can you talk a little bit about your background growing up with what sounds like a really cool family?
My brother, he was my man of honor at my wedding. So we're very close. He was born in Baghdad, Iraq. I was born a year later in England, where my father was studying to get his PhD. And the plan was to go back to Baghdad. That's where all of our family was. My father had a job lined up, a government job, because he was on a government scholarship. But it was the late 1970s. Saddam Hussein was kind of rising in power. And my parents kind of firsthand witnessed what it would be like under a dictatorship, what it would be like to live under oppression and tyranny and unable to speak freely. So my parents decided to move to the States where there was kind of this growing Iraqi diaspora, and to the Metro Detroit area where most of the Arab Americans are. But we didn't immediately come to the Metro Detroit area. We actually landed in the Upper Peninsula of Michigan, which is 12 hours away from the Lower Peninsula of Michigan.
Very cold.
Very, very cold. So imagine this like Iraqi family moving from like the desert to northern Michigan on Lake Superior. So we were there for a couple of years and then ended up downstate. And none of that story, it was going to be kind of part of my book or, the book was just going to be like, hey, this is like me in this middle of this kind of emblematic environmental and public health crisis. And I wanted to give you like a firsthand account. And that's the book I started to write and the story I wanted to share. But then fairly quickly, I realized like, I can't tell you like why I'm a pediatrician or how I ended up in Flint or why I did what I did and continue to do what I do without telling you like who I am and where I came from. So this book is weird. So it's very much this kind of mix of this personal and family narrative. And I think it's surprising for a lot of folks because like the first sentence of my book is, I am Iraqi, an immigrant born somewhere else, but not in Baghdad, like my older brother who was named Muakkad. So, so in a sense, it also became very much this immigrant story of this kid who came here when she was 4, who like most immigrants was leaving somewhere bad and hoping to come for something better. So that perspective gave me this kind of everyday gratitude of being in this country. We have first cousins who were undergoing air raids and shelters and sanctions and dads in endless war after endless war. But that perspective also kind of gave me like a keen eye to what injustice could be and what people in power could do to vulnerable populations. And I think my parents never shielded my brother and I from what that could look like. And they also instilled in us that no matter who you are or what you do, you fight for justice and you fight for the most vulnerable among us. And that was a kind of instilled in, not only what they said and what they shared, but also in so much family history and oral history. And I'm going to kind of quickly share, I think, one story that I love that really kind of exemplifies that. It's the story of my great uncle Nuri, and my brother and I both did a lot of research about him during the writing of this book. And we were finally able to get some documents that our family didn't have before. So he was like this kind of rebel. And the craziest thing about him, my mom would tell me when I was a kid, was that he had a tattoo. I'm like, oh my God, he had a tattoo. But like he was always on the run. He was always fleeing the authorities. He went to MIT in the 1930s to study railway engineering, but got kicked out because he like became like this little activist. And when he went back to Iraq, created an organization called the Association Against Imperialism and Fascism. Like I would join that group now. Love it. And like he fought for Palestine's independence against British rule, all these different causes. And then he found his way as one of 2 Iraqis that went from Baghdad to Spain to fight in the Spanish Civil War as part of the international brigades. And because he was like in the US for like a minute, he was lumped with the Americans as part of the Abraham Lincoln Brigade. So we were finally able to get like his paperwork because we used one of his pseudonyms, and we were able to get his like application and like, all his service during the Spanish Civil War, which was like this quintessential fight for freedom. Yeah. Right. And like growing up, hearing his stories, like here was this guy, it wasn't about like his country or his religion or his race. It was about doing the right thing, even if it was like really hard, even if you risk your life, you do the right thing. So those were the stories I had to share with you, because if you know some of these stories, you kind of understand when it came for me to do the right thing, like there wasn't a choice. I had to do the right thing. Like I had to, because there were bigger things at stake that were way beyond me.
Wow. What a life. What a life. Amazing.
We all have these amazing stories in our family history. We all have them.
It is so true. The more you dive into people's lives, especially in your family, you can't help but find some of these inspirational stories. So thank you for sharing that. So you mentioned that your childhood kind of steered you towards your interest in pediatric medicine. What was it about your childhood specifically that piqued that interest?
Yeah, I think there's like several things. I don't know if there was one like specific thing. I
Yeah.
was obsessed with MASH when I was a kid. Like I remember one Christmas, I got all the MASH episodes like on the VHS. I think that was one part of it. Like I wanted to be that
Yeah,
funny
yeah.
Hawkeye Pierce. And then I was in a car accident when I was a kid. I was like 5 or 6 years old, driving from the Upper Peninsula to the Lower Peninsula during winter break. I broke my neck. I fractured my jaw. I was cared for really well. And I think that was one of the reasons that I also went into pediatrics. My brother and I were both kind of really moved by activism and organizing and environmentalism in high school. We helped shut down an incinerator. And that like early experience like connected for me environment and health. Like, here was this thing that was, polluting the environment. And the kids in the neighborhood had high rates of asthma and adults had higher rates of breathing problems. And oh my gosh, it happens to be like this environmental injustice community. But look, we elected a state rep and the first thing he did was shut down an incinerator. And so it taught me not only the connection between environment and health, but also of youth organizing and policy making and what good policymakers can do to serve their community. That kind of pushed me to go into more of environmental health and eventually into medicine and pediatrics. So, I think there's a lot of reasons why pediatrics of all the medical specialties is so much fun. Like you get to hang out with kids all day. I love it. Like when I am in clinic, it's a recharge. I come home and there's a smile on my face. So pediatrics is also part of our job description is that advocacy piece to it. Like I'm a clinician, I'm a researcher, I'm an educator, but I'm also very much an advocate. It was part of my professionalization. I had done things like media training and advocacy training, and I had met with policymakers and talked to journalists like before the water crisis, because it was part of my profession as a pediatrician. So I think all of these kind of ingredients are what pushed me to pediatrics.
So if I remember this right, I guess you had two memories of Flint, one involving Auto World. I think I got that right. And then the second one happened in medical school. Can you talk briefly about Auto World? I found that interesting.
I almost got you picked up my Auto World mug when I got here. Gosh, when did they create Auto World? I think it was in the 1980s. And this was an effort to bring folks kind of back to Flint to make it a tourist attraction. I think at one point it had a partnership with like Six Flags or some other like big parks company. And it was this kind of giant bubble dome, and you learned about the history of the automobile, and it ended with like automation and robots and look, people losing their jobs. So it failed. I don't think it lasted more than a few years. So it was a failed experiment. But I remember that was my first experience with Flint, which wasn't so positive. And then my second was as a medical student. So I went to Michigan State University for medical school, and we were the very first community-based medical school in the country. So my clinical training as a medical student was in Flint. So that's where I did my clinical rotations, and that's where I fell in love with the city, where I fell in love with the people.
And to the point where in 2011 you came back to Flint, right? So what was it about Flint that drew you back to the city?
Yeah, it's it's surprisingly a place that you get attached to. The people are loyal, they are proud. There's this incredible grit and resilience, and it's a city that's always trying to move forward, despite its history, both positive and negative. So I was so shaped by my experience in medical school, and I felt so rewarded. The city had given me so much. And in 2011, when the opportunity came back to Flint to train the next generation of pediatricians, I felt like it was an opportunity to get back to the city, but also an opportunity to merge the disciplines of medicine and public health. After I did my residency in Detroit, I went back and got my public health degree in health policy. And as a medical educator, I wanted to make sure that my future doctors that I trained or helped train really had a broader perspective of not just kind of the patient in front of them and what's ailing them today, but also about all the other things, the societal things that can also impact the health of our patients. It's been said that pediatricians are the ultimate witnesses to failed social policies. And we see it. I see it every day in my exam room. with so many of our children where their trajectories are not based on their potential, but really on these other circumstances way beyond their control. So that's kind of what pushed me to come back to Flint, was to be able to wear both of these hats to bridge these often kind of disconnected silos in the training of the next generation of pediatricians.
Mm. You mentioned the word serendipity earlier. So I was touched by this moment in the book. You brought up your childhood friend, Elin, who used to be with the EPA, and then she had a conversation with you at a barbecue. By the way, I'd love to know what's in Elliot's secret barbecue sauce that you mentioned in the book, but maybe that's for a private conversation later. I'd love to know what's in that.
Top secret.
Yes. But can you talk about that conversation you had with Elin that kind of changed everything, right? Changed the course for so many people.
Yeah. So it was, late summer 2015, and my high school girlfriend, who was also really involved in environmentalism in high school with my brother and a few others, she went on to pursue a degree in environmental engineering and become a drinking water expert, and spent most of her life in the DC area, worked at the EPA, and had just come back to Michigan to be closer to her family. And literally a last minute text, "Hey, Elin, you want to come over? My husband's barbecuing." And she's like, "Oh yeah, I think I can make it." So she brings her kids, we hang out, kids are running around screaming. My husband's barbecuing, telling everybody his secret recipe. And she corners me in my kitchen, and she's like, "Mona, I just saw a memo from one of my former colleagues at the EPA, an amazing whistleblower at the EPA, Miguel del Toro. And he is saying that the water in Flint's not being treated properly, that it's missing this really important ingredient called corrosion control. Without corrosion control, there's going to be lead in the water." And that is the exact moment that my life changed. Like from that moment on, I literally stopped eating, I stopped sleeping, and it became really kind of a quest to find out what was going on because of that word lead.
So you mentioned that night in the book. By the way, guys, seriously, go out and I recommend the audiobook because Dr. Mona reads it and she'll get stuck in your head. And you hear it.
My apologies in advance.
Wonderful voice, wonderful reading voice. But that night, you're sitting there trying to think like, what am I going to do? You're staying up all hours. You're exchanging messages with Elin. At that point, did you know what you were going to do with this information? Other than you had to do something, I guess, right?
Yeah, I had no idea. Like, I think there was like a naive part of me that was like, "Oh, this has to be wrong. Like, how could this have happened?" Like, I really wanted to be proven wrong throughout this whole process. Like, even when I started doing my research to see what was happening into the blood levels of children, I didn't want to be right. Like, I did not want to find that there was more lead in our kid. It was a sense of disbelief, but also just heartbreak. Like, this was entirely preventable. And it was just mind-boggling to see that it had gone so far for so long.
Talk a little bit about why there was this switch in water source and the kind of the background story of this whole water crisis, why it all started.
Yeah. So I guess for your audience, I will emphasize that, this is a water story, and it's a public health story, and it's a whistleblower story, and it's a science story, and an infrastructure story. But more than that, it's a democracy story. So the same year that I came back to Flint in 2011 was also the same year that Flint lost democracy. I don't think it's related to me coming back, but it just happened to be in 2011. And Flint became under the control of emergency managers. So let's rewind a little more here. So the state of Michigan voted down emergency managers. On a statewide ballot, the people of Michigan said, "We don't want emergency managers running our cities." And then our legislature, which happens to be one of the most gerrymandered legislatures in the country, tweaked it, pushed it through. It was signed by the governor. So we had a law on the books that was, first and foremost against political will of the people of Michigan. And, all of a sudden, so many cities throughout our state lost democracy. They were under the control of these emergency managers, unelected and unaccountable officials who reported to the governor. And their job mainly was austerity. It was about cutting costs. And they were predominantly in majority minority cities. At one point in Michigan, half of our African American population was under emergency management, compared to just 2% of our white population. So this part of the story, this corrosion of democracy part of the story, just like so many other parts of the story, is something that is so relevant to what's happening today, where throughout our country, be it through voter suppression or power grabs or, gerrymandering or whatever, also speak to the inability of, having proper representation and people's voices at the table, especially in critical decision making. So we were under emergency management. Their job was to save money. They weren't listening to anybody, which is, I think, one of the reasons that so many folks who were raising their voices weren't being heard. Kind of flash forward when after we became a federal emergency, there was a congressional oversight hearing led by Congressman, God bless him, Elijah Cummings, who has since passed away. And he asked the emergency manager, who was subpoenaed. He's like, why didn't you listen to the people? Like, they were coming to you with concerns and brown water. Like, why didn't you listen to them? And his response was something like, I didn't have to. Wow. So it was under this emergency management rule that it was decided that Flint would change its water source to save money. For half a century, we were getting our water from the Great Lakes. So I cannot tell the story without sharing my hand. So Michigan is the mitten state surrounded by the Great Lakes, which are the largest source of fresh water in the world. 21% of the fresh water in the world is around Michigan, and here's Flint. And for half a century, we were getting our water from the Great Lakes. And in April of 2014, our water source was changed from the Great Lakes, which we bought from Detroit. It was treated in Detroit and sent up. It was changed to the Flint River. So that's a little bit of how we got into this mess. But like every good story, there's even more nuances, and it's so important to kind of to learn the history, because it's, if you rewind even more, it's a history of capitalism, of what happens when an industry leaves its birthplace. It's also a history of kind of racism and segregation and population loss and disinvestment. And there's a lot to this history that got us to the point of being near bankrupt. But in the recent past, it is also very much a story of lost democracy, usurped democracy that created this crisis.
So they switch from this freshwater source, Lake Huron, to a river that's been known to catch on fire periodically. And then they forget to put in this corrosive control, which causes service lines to leak lead into the drinking water of the residents. What is the effect of lead on the body, especially for young children?
Yeah, and this is kind of why my life changed when I heard about the possibility of lead being in the water. As a pediatrician, as a scientist, we respect the science of what lead does. And over the last few decades, especially, that science has become abundantly clear. Although for centuries, we've known lead has been a poison. It's probably the oldest and most well-studied neurotoxins known to man. And women. So it is, it affects the developing nervous system. So it especially affects young growing children. It causes things like decreasing IQ levels. So it impacts cognition, it impacts behavior, causes developmental problems, attention problems, focusing problems. It's even been linked to things like oppositional disorder and violent behavior and criminality. It can also cause a lot of kind of long-term health problems. Kids exposed to lead as adults and seniors can develop things like high blood pressure and kidney disease and gout and early dementia, and Alzheimer's. So it has these life-altering consequences, which is why, especially through this incredible science over the last few decades, we have come to appreciate that there's no safe level of lead. Levels that we thought were okay decades ago, even when I was a trainee, we thought there was an acceptable safe level. There is no safe level. None. There has not been a level that has not been found to have a deleterious impact, especially on developing children. So because of that, the CDC and the American Academy of Pediatrics and so forth recommends the practice of primary prevention when it comes to lead. And in public health, that is this concept that we're never supposed to expose a population to lead because of the potent, irreversible consequences of lead exposure.
So knowing all of that, and after a night of fitful sleep, researching all this with Elin and kind of the back and forth, the next day you go in and you see your patients and they're asking about adding water to formula and drinking water. Can you talk a little bit about that?
Yeah. So for over a year, my patients were coming in periodically with concerns about the water. Like, are you sure we should drink this water? Like, we've been all of medicine and public health has been on a big push of more water, less pop, less soda, less sugar sweetened beverages. We have epidemics of childhood obesity. So, we're like, yeah, water's, definitely, tap water, it's safe, it's healthier. Families would come in with like, whenever I bathe my baby in this water, they get a rash and it's usually right to the water line. Mm-hmm. Do you think it's the water? And we're like, oh, maybe not. So much of medicine is like tincture of time, reassurance. And then, as you mentioned, our families, in Flint and in many of our underserved communities, there's unfortunately low breastfeeding rates. So many babies are on formula. And formula is prepared by mixing powder with water. And this is pretty much all a baby consumes, exclusively, often until about 6 months of age. That's it. Powder mixed with this toxic tap water at a time when your brain is growing the most. And for about a year, it was reassurance. Like, how, of course, the water is safe. And like going through my head, and I think everybody in the nation's head before Flint happened is like, how could our tap water not be safe in this country? Like, this is America. We are the richest country in the history of the world. It is the 21st century. Like, we have rules and laws and regulations, and our tax dollars pay people to make sure that their job is to make sure that we have clean water if we live in Virginia or, Michigan, wherever. So all those things were going through my head, in addition to all the reassurance from everybody in charge, the scientists, the bureaucrats, the epidemiologists, all the folks that work in all these bureaucracies were saying everything was safe. Everything was in compliance, telling the people of Flint that they should relax, literally relax, that everything was okay. So I unfortunately drank that Kool-Aid. And for a year was also telling my patients it was okay. And that all changed after hearing about lead in the water, because it can never be okay with the possibility, even the unproven possibility of lead being in the water, but it was proven. So after that point, it was no, don't use this water. Use bottled water. And by then filters were not available, but please, take alternatives. So it all changed when I heard about lead in the water.
Dr. Mona, we talk about when we see something, say something, and you said something, right? You contacted public health officials and they talked about how it wasn't in their job description to deal with water. That was somebody else. And it was kind of this constant passing the buck. At some point, did you wonder if any of this would change? Did you find yourself getting frustrated, or you just kept pushing forward?
Yeah, I mean, a part of me thought it would never change. And the precedent that we had prior to this was the Washington, D.C. lead and water crisis, which literally lasted years, a really, really long time. Huge cover up, super high levels, it went on for a long time. So I was kind of expecting the same. I was expecting that this was going to go on for a really long time, but, kept trying to, learn more, press every button, getting pushback from folks like, oh, this isn't your job. This is somebody else's job. Like, that's not what you're supposed to do. That's what like public health is supposed to do. And then you go to public health. Well, that's not our job. That's the water people's job. And they're like, well, everything's okay. So I kept saying to myself throughout this time, I'm like, I don't know how people sleep at night. Like, I don't know how people were going to bed at night knowing that there was lead in the water. And to this day, like, I don't know how these folks, could live with themselves knowing that this was happening and that they weren't doing anything about it.
So I find this fascinating. So you decided that you're going to dive into the data yourself, right? You look at when the water was switched, what the blood levels were, and the after blood levels, right? And compare those. Can you talk a little bit about that research? And you did it in a matter of days. This stuff usually takes years, right? With peer review studies and things of that nature.
Yes. So, like I said, blood lead levels are part of surveillance programs. Like, I'm just one doctor in one clinic. Like, I can tell you about my patients, but I can't tell you like what's happening at the population level. That's one of the differences between medicine and public health. It's the individual versus the population. So I tried to get that population level surveillance data from the county and the state, was unsuccessful. But then realized that my hospital, my children's hospital, like it turns out we actually process most of those labs for the greater community. So went through all the necessary kind of research permissions and protections to get the data for was entirely processed through our hospital, and looked at blood levels before the water switch and compared them to blood levels after the water switch. Looked at the city of Flint, so looked at like mapping, and we had geographer friends helping, and noticed that in the city of Flint, there was an increase in kids with higher lead levels. In the areas where the water lead levels were the highest, we saw the greatest increase in children's blood lead levels. So, like you said, when you do research, it goes through this really important peer review process. And that takes a long time. That can take months. Like I have papers I've submitted like 6 months ago. I haven't heard back yet. From reviewers. So that takes a really long time. And our kids in Flint didn't have one other day to spare. So that's how we decided to just publicly at a press conference share this research.
So in the intro to this show, I rattled off some of the awards and recognition. One that caught my eye was something that you mentioned in one of your talks, that you received the Disobedience Award from MIT.
It's my favorite.
I love that. Well-deserved and earned. May we all earn that award someday. That's great. So eventually, things started catching people's attention. But you mentioned the DC water crisis, which to me seems strikingly similar. You would think that would have put people on notice across the country that these things happen and we should take it seriously. Why don't you think that caused people, including one of your mentors, right? Dr. Dean, didn't really understand fully what was happening here?
Yeah, the Flint Water Crisis wasn't the first, it wasn't the worst, and unfortunately, it wasn't the last either. So we've had about a century and a half of lead and water crisis where we've really failed to learn from history. We've failed to learn from past crises. And I think this speaks to so much in public health. Like we have a crisis, people are like up in arms, we forget, then we have a crisis again. They're like, how did this happen? And we forget. And I hope this doesn't happen with the pandemic, because some of the same lessons, but we have to do better. And, the DC water crisis, like I said, it was in the early 2000s. It was worse than Flint, and it lasted for several years. The levels were even higher. And it took a long time for that crisis to be exposed. And, maybe because they didn't have that proof of harm, data, right away, but you shouldn't have to have that proof of harm data. We shouldn't have to prove people are being hurt before we do something about it. That reactive mentality just, doesn't work. So, and unfortunately, after Flint happened, we had another similar water crisis in Newark, New Jersey. They continued to happen. Our regulations are lax. The lead and copper rule at the EPA, which is part of the Safe Drinking Water Act, hasn't been updated in forever, in about 30 years. It's in the process of being updated right now. There actually were updates proposed in January under the last administration. However, the current administration is reopening those to hopefully make them stronger. So there's some great things, the great possibilities happening right now to finally learn the lessons of Flint. And I'm super excited. I'm actually kind of giddy about the national possibility of removing all of our lead pipes. So as part of President Biden's America Jobs Plan, there was a proposal to remove all of our nation's lead pipes. And this will finally make sure that we learn these lessons and don't have another DC or don't have another Flint.
Amazing. Yeah, as we're recording this, they're considering the infrastructure bill, and there's a $35 billion water infrastructure bill that recently passed the Senate, and Senator Tammy Duckworth has really been leading the charge on some of these things. So important. So Dr. Mona, you decided to write a book. You have testified in front of Congress many times. You are telling your story all over the place. You're talking to me. Why do you keep telling this story?
So it's the same why. It's the kids. It's my kids. It's my Flint kids, but it's kids everywhere. Because this is not an isolated story. The story you just heard about that crazy city that had the brown water and didn't treat it properly, read the whistleblower and all this, that's not unique to Flint. This really speaks to so many of the deeper crises in our nation, be it of deteriorating infrastructure, be it of the disrespect of science and scientists, be it of our chronic disinvestment in public health and in what keeps people healthy, rather than focusing so much on taking care of people once they're sick. But it's also the story of inequities of how, certain people get harmed more than other people. So, I share this story to encourage folks to open their eyes to these injustices. So going back to kind of what the eyes don't see, the title of the book. So it's about lead and water, which is clear. And it's about not seeing the consequences of lead because, you see those consequences later. But it's about people and places and problems that we choose not to see. People's eyes were closed to Flint. Like they literally had this blindness, this indifference to this population. But it's on all of us, once again, no matter who we are or what we do, to open our eyes to these injustices that are literally happening outside our front doors in our own communities. And more important than just kind of being aware or woke to these conditions is taking action, is being that brave and courageous voice that stands up and speaks up. It's about being the whistleblower when systems and people want you to stay quiet. It's about doing the right thing that is often the hard thing. So that is why I share my story, because we have a lot of unfinished work to do.
I'm struck by your stories. I went through it in your book that how many things had to line up, right? A passionate pediatrician who took her oath seriously, who had a high school friend who worked in the EPA, who was aware of a problem happening in the city that she worked, and she had access to. It's just amazing. But it also highlights the reality that you're right. I think there are a lot of Flints out there that don't have these stars lining up. And there likely is somebody listening to this or watching this show today who recognizes a problem, and that hopefully this gives them that inspiration to step forward. What would you say to that person as they're thinking about saying something? It's see something, say something, do something. Sometimes that do something that makes things move.
Yeah. One of the reasons I did not want to write a book and I pushed back was like, hey, it's not a story about one person. This is a story about a team, an unexpected team that came together to do this work. And when folks come to me with, say, like a concern that they have in their workplace or in their community, and they want to do something and they don't know how to do it, my suggestion is often find your team, because there's going to be moments when you're down and they're going to lift you up, and there's going to be moments that they're down and you need to lift them up. We have to do this in solidarity with others. And I think so often that, especially I talk to a lot of young people and students who care about so many things. And I think so often they feel that like they're carrying the burden of all the world's problems on their shoulders, and that nobody else cares about all these things as much as they care about. And then they're pleasantly surprised. We're like, oh my God, like that person also cares about this. Let's do this together. So when you can do this work, with peers, with unexpected peers, like, before my work in Flint, like I kind of thought like I hung out with lots of other pediatricians and academics and doctors and educators. And like, we went to our own little conferences and like, we kind of thought we had a monopoly on like this field of work, like kids. And I loved being proven wrong throughout the story, because like, hey, when you part with like environmental engineers and journalists and like bureaucrats and like high school friends and all these random people, like when your team is bigger and diverse and so multidisciplinary, you ask different questions and you come up with different solutions, and you take care of each other. So find your unexpected teams. This is very hard to do alone, and not only a team professionally, but also a team personally. So we talked about about the personal toll of being a whistleblower. It's hard. You can't do that alone. You need a village of support also in your personal life, be it family or friends, as you're going through this process, because it's hard.
Amen. Dr. Mona, I really appreciate you taking time. I just want to acknowledge you for your courage, your persistence, your disobedience. Thank you so much for inspiring, hopefully, the next generation of whistleblowers going forward. So thank you so much for your time today.
Thank you. It was great to be with you.
What a story. Dr. Mona stood up for her patients and the public. In her book, she discusses how the General Motors plant in Flint, Michigan, recognized that there was something wrong with the water early on, after seeing the corrosive effect the water was having on engine parts washed down by Flint Water. In response, General Motors was able to secure a pipeline of fresh water from a different water source. The people of Flint, Michigan, did not have this option. Indeed, even after several news reports and citizen reports, nothing happened. It took Dr. Mona's voice to sound the alarm so loud that people in power had to listen. Her advocacy not only positively impacted the water in Flint, but it has set in motion changes across the United States, including pending legislation that should make drinking water safer for all Americans. Perhaps that is the lesson of today's episode. We tell people that when they see something, they need to say something. But sometimes it takes a chorus of people. And when you add enough influential voices to the choir, the sound is heard. Next week, we spend time hearing from another story of people standing up together to sound the alarm. On the next episode of Fraud in America.
If you believe you've witnessed fraud against the government at your job or want to learn more about these important laws to combat fraud, visit fraudinamerica.com. On our website, you can find whistleblower lawyers, logs from these expert attorneys, and more. You can also find a transcript of today's show notes, a way to contact our team, and a way to chip in to make sure we can keep bringing you the latest on fraud. This episode was edited and produced by Rachel Brooks, and our theme music is by Connor Chaos. A big thanks to our staff and researchers of Jeb White, James King, Emma Bass, Jackie DeMar, Kate Scanlon, Brian Markovitz, and Max Boltman. You can learn more about them at fraudinamerica.com/team. Fraud in America is a project of Taxpayers Against Fraud Education Fund.